All right. Well, I'm going to go ahead and get started. Welcome, everyone, and thank you so much for joining me today. My name is Hannah, and I am so excited to spend a little bit of time today talking about a topic that affects every single one of us, and that's healthcare finances. So, when people think about financial planning, they often focus on things like saving for a home, paying off debt, or maybe even preparing for retirement. But healthcare is actually one of the largest expenses that we'll face throughout our lives, and it's something that deserves just as much attention. So, today we're going to look at practical strategies that can help you take control of your healthcare spending, as well as make informed benefit decisions and just overall prepare for future healthcare needs. So, whether you're just getting started with saving or you're already planning for retirement, my goal is just to leave you with some actionable ideas that you can begin using right away. And as I go through this presentation, if any of you have any questions, please feel free to put that in the chat box or in the Q&A section of this webinar, and I'll be sure to answer those questions at the end. And I'll leave plenty of time for questions so we can go back to anything in this presentation if we need to. So, today we're going to dive into financial accountability, specifically how to manage healthcare expenses and evaluate your personal financial situation. So, I'll just share practical tools and tips to help you assess where you are right now and then identify any areas for improvement. We'll also explore health savings accounts or HSAs, which can be really powerful tools for covering current medical costs as well as saving for future healthcare needs even in retirement. And just to preface, don't worry if you don't have one through your employer. Those can also be opened up independently as well, as long as you're on that high deductible health plan. But then I'm just going to wrap up with some strategies and additional resources for you just to help you prepare for retirement, maximizing your savings, and just ensuring access to quality care, all with the goal of building a healthier financial future that just aligns with your goals, whatever those may be. So, before we talk about accounts and additional contribution limits in retirement planning, I just want to take a second to focus on something even more important, and that's going to be your habits. The reality is that taking control of your healthcare finances doesn't happen because of one big decision. It happens because of a series of small intentional choices that are made over time. So, in this section of the presentation, we're going to walk through 5 practical strategies that can just help you become more proactive, maybe even more informed, and ultimately just more empowered when it comes to managing your healthcare costs. And many of these strategies are actually really simple, but when they're all combined together, they can really have a significant impact on your financial future. So when most people create a budget, they account for, housing, groceries, transportation, entertainment, etc. But health expenses often get treated differently and are only considered when the actual bill arrives. So instead, think about your healthcare finances as an important category within your overall financial plan. Start by tracking your healthcare spending throughout the year. That's always the first step. Understanding what you spend on those expenses, prescriptions, office visits, dental work, vision care, that's just going to give you valuable insight into your financial habits. It's also important to shop around wherever possible because healthcare prices can actually vary dramatically depending on the provider. I always use purchasing a car as an example. That's something that people will spend hours researching on and on until they find the car that fits them best. But then when they go to the doctor, they just say yes to the first price that comes up. So I would always take a pause there and definitely shop around for those prices. You also want to make it a habit to review your bills, especially your explanation of benefit statements and any additional receipts just for accuracy. Human mistakes happen, and you just want to make sure that you're getting billed correctly. And also plan ahead for any larger expenses and build an emergency healthcare fund. The more intentional that you are today, the less financial stress that you're going to face when unexpected medical needs arise. And one of the biggest mistakes that people make during open enrollment is assuming that last year's benefits are automatically the best choice for this year. Life changes, healthcare needs change, and benefits offerings can also change as well. And that's why it is so important to approach open enrollment as an opportunity to reassess your situation. I highly recommend just taking time to review all of the available plans that are available to you. Compare those premiums and deductibles, and just evaluate any new benefits that may be offered to you as well. Think about any major events coming up. Are there any changes in your family, or are there any shifts in your healthcare usage? Even if you've been happy with your current plan, which that's great, you may discover that another option that offers greater value or lower overall costs. Or as your healthcare needs change, maybe the plan that you're enrolled in right now isn't going to be what you need later. I always like to use this as an example, but somebody who is young and single and on a high deductible health plan at the moment, they don't have a lot of healthcare needs. But let's say they get married and then they become pregnant or are starting a family. The high deductible health plan may not be the best choice, and maybe a PPO or traditional health plan may be the better option for them. So, with that being said, spending just a little extra time reviewing your choices can potentially save hundreds or even thousands of dollars over the course of a year. Healthcare may not feel like shopping, but in many situations it absolutely is. So prices can vary significantly between providers or facilities or pharmacies, and as well as treatment options that can also vary in price. So that is why one of the most important skills that you can develop is learning how to compare costs before receiving care whenever possible. I think something that is the most common is using prescription pricing tools like GoodRx. I think that's become really, really popular. But you also want to think about maybe asking for generic alternatives if that's possible for your prescription. And don't hesitate to request cost estimates for any procedures or services. This is something I don't see people do often enough. Many providers are actually willing to discuss those options if you ask, but you have to advocate for yourself. And just remember that being a savvy healthcare consumer doesn't mean sacrificing quality. It simply means gathering information, asking those questions, and then making an informed decision for yourself. A few minutes of researching today can really lead to meaningful savings tomorrow. And a few extra steps can just lead to big financial benefits over time. And one of the challenges with healthcare planning is that many of the biggest expenses don't happen immediately. There's often years or even decades away. That's why it's really important to take a long term view and start thinking about future healthcare needs now. And I know that can sometimes be overwhelming, but here's a few ways to start. One, consider your family health history. Is there somebody in your family that maybe has a heart condition or diabetes or something else that could leave you at risk for those similar illnesses? Two, look at your current lifestyle. Are you being active enough? Are you taking care of yourself? Are you taking your daily vitamins? Things along that line. And then look at any potential healthcare risks that may emerge over time. It's also important to understand that Medicare does not cover everything. Many retirees are surprised to learn how much they still pay out of pocket, which it can be pretty alarming. And I'll touch on a little bit of that later on in this presentation. But by thinking about these realities today and creating that savings plan that reflects your future needs, you're going to give yourself more opportunity to prepare rather than in reaction. And then the last strategy that I'm going to talk about is paying for out of pocket costs with pre tax dollars. So, this strategy is one of my favorites because it's what I work with every day and because it can provide immediate financial benefits. So, accounts like health savings accounts and flexible spending accounts Those allow you to pay for qualified healthcare expenses using those pre tax dollars, which means that your money is going to go further. So, depending on your tax situation, that could be giving you a discount of 20% to 30% or even more on eligible expenses. I always like to use an $1,000 expense as an example. So let's say that you go to your dentist and you have a procedure done and it's $1,000. If you pay for that expense out of your HSA or FSA, you're automatically saving anywhere from $200 to $300 on taxes. So that can really be substantial. And if you have access to an HSA, take time to understand all of its benefits because it really can be extensive and not a lot of people know just how flexible an HSA is. Many people use it simply as a spending account, which is totally okay because that is a part of its intended purpose. But it can also be a really powerful long term savings tool, as well as just remember to keep records, save your receipts, and strategically manage any reimbursements. All of those things can really help you maximize the value of every dollar that you're contributing. So, switching gears, we're now going to talk about how to analyze how much you should be saving for healthcare. And this is probably one of the most frequently asked questions I receive. And unfortunately, there's no universal answer, but there's a way that you can analyze what your situation is and what you maybe need to save for the future. And that's what we're going to talk about today. So, the right amount actually depends on your unique circumstances. Instead of focusing on someone else's number, focus on understanding your own situation because it's going to be different for everybody. Review your healthcare spending history. That's the first step. Think about your medical needs, family history, future plans, and retirement goals. The objective section, obviously, but what it is going to do is create a realistic target based off of information that is meaningful to your life. And that's what we're going to look at here. So, every successful financial plan is going to start with understanding where your money is going and then where you want it to go. Take time to build a realistic budget and identify your long term goals. Think about what retirement looks like for you. Maybe are you planning to travel? Are you thinking about spending more time with family? Maybe relocating? All these decisions can really influence your future financial needs. The good news with that is that you don't need to start with large contributions. And I think that's something that really overwhelms people. But consistency often matters way more than any amount that you contribute. Even small contributions made regularly can really add up significantly over time, especially when combined with the tax advantages and investment growth opportunities that are available through the health savings accounts. The next thing that I want to talk about is understanding your health insurance. And that is one of the most important financial skills that you can develop because no matter where you go in your career, this is something that you're going to want to take note of. Many people know which plan they're enrolled in, which is great, but they don't fully understand how that specific plan works. So take the time to review your deductible, look at your copays and coinsurance, as well as out of pocket maximums and additional premium costs. Then from there, consider what your total annual exposure could be under different scenarios. And this can really vary drastically from plans. I've seen out of pocket maximums be anywhere as low as $3,000 in a given year to $14,000 in a given year. So it's really important that you look at that. And if you anticipate any major healthcare expenses, your ideal plan may look very different from someone who rarely visits the doctor. So, again, looking at that high deductible health plan versus maybe a PPO or traditional health plan. The more familiar you are with your coverage, the more confident that you'll feel making healthcare decisions throughout the year. And if your employer does offer open enrollment meetings, that is a really great time to ask those questions and make sure that you are aware of the coverage options available to you. The next thing that we want to look at is factoring major events. I talked about this a little bit earlier with life events such as childbirth, marriage, etc. But healthcare planning does become much easier when you know your anticipated expenses before they happen. So if you know that a major life event could be in your future, start preparing now. Really expensive examples here. One, childbirth, that's an expensive one. Orthodontia, if your kids are going to need braces or if you're going to need braces. And then think about any elective procedures as well, maybe a hip replacement, knee replacement, maybe additional surgeries that you know are going to be on the horizon. And look at other large expenses that often require substantial out of pocket costs. Rather than scrambling when that bill arrives, because nobody wants to do that, you can really build a saving strategy oh my gosh, you can build a saving strategy that gradually prepares you over time. So even a modest amount set aside regularly can really grow into a meaningful financial cushion. And that could look at different for everybody. That could be $10 a pay period, that could be $20 a pay period, maybe $100 a pay period. Whatever you can afford can drastically help you in the long run. And planning ahead doesn't just reduce any financial strain, it's also going to give you greater flexibility and just overall peace of mind. And that's something that I've heard a lot when people start to analyze those major events is they understand what's going to be in the future, they prepare for it now, and when that situation does arise, they have the money there and they can focus on the things that matter. Especially with bringing a new child home, the thing that you're going to want to focus on is obviously raising your child. It's not going to be that hospital bill that's coming to you in the mail. So that's just another example that I like to throw out. And healthcare expenses are not always predictable, and we know that. So, some years may be relatively inexpensive, which is great, while others can include unexpected emergencies or major treatments. Maybe your child has a broken bone, or maybe that you get into a car accident. It's unfortunate, but we have to prepare for that as well. So, that is why it's really critical to think beyond a single plan year and really focus on long term financial resilience. Building a healthcare emergency fund is going to do one of two things. One, it's going to create a safety net for those higher years, but it's also going to allow you to handle surprises without disrupting other financial goals. So you're not going to have to tap into that emergency fund or pull from investments, or I've even seen people have to pull from their retirement funds to pay for expenses. So the goal isn't to prepare for every possible scenario because I think that's really going to overwhelm you and that's not the intended purpose. What this is going to do is it's going to create just enough financial flexibility that unexpected healthcare expenses don't become a financial crisis. And that's what I mentioned the out of pocket maximum, because that's the maximum that you're going to spend in an entire year. I think that's a great number to start off with when you have a financial healthcare savings goal in mind, because at least it's achievable and then you can start to snowball from there and even think about investing in your HSA. So it's also really important to understand how your HSA works. And I talked about that a little bit more, but now I'm going to go into a deeper dive on that. And the really important thing here is how you can make the most of your HSA. So if you're enrolled in that high deductible health plan, you're likely eligible. And even those small, consistent contributions that I talked about can really add up over time. When I started, I just contributed $15 per paycheck and then gradually increased that every year as my budget allowed. And HSAs cover a wide range of eligible medical, dental, and vision expenses. So just be sure to check what qualifies. And if you're ever unsure, don't hesitate to reach out to Omnify or your HR team as well. We are always here to help. But one of the biggest advantages of the HSA is its long term flexibility. So, if you're looking at a flexible spending account or you have one right now, those funds are going to be use it or lose it. But with the HSA, because it's an individually owned account, those funds actually roll over year after year and they can be invested. And I think something that's really cool is after age 65, you can actually make penalty free withdrawals for non medical expenses, though your regular income tax would still apply. But that's really great because you're going to then have, if you already are planning for retirement, you then have two retirement accounts. You have your HSA that you can use for medical expenses in retirement, and then you have your 401k or Roth IRA or other retirement account that you're able to use for your everyday retirement expenses. So whether you're saving for future healthcare or you're building up that backup retirement fund, your HSA is really going to be a powerful tool either way. So I always like to throw this slide in here because it provides a really great visual representation of how your HSA works. So you can contribute money through payroll deductions before taxes are taken out. And what that's going to do is it's going to reduce your taxable income. From there, those funds can be available for qualified medical, dental, and vision expenses. for you and your eligible family members. So this isn't just for you, this is for your entire family. And one of the biggest advantages is that unused funds roll over year after year, like I had mentioned. So unlike some other benefit accounts, your money is going to remain yours at any time. And that's also, I think, people realize that investing can become a great resource for them. So, all in all, that flexibility is going to allow you to use the account how you need to use it. And each year, the IRS does establish contribution limits for HSAs, and it's important to always know what those limits are so you can maximize the opportunity if your budget allows. So for 2026, for individuals, that's going to be $4,400 that you can contribute. And then for family coverage, that's $8,750. And then for individuals age 55 and older, you can actually contribute an additional $1,000 catch up contribution. And your spouse, if they're 55 or older, can add a $1,000 catch-up contribution to their own HSA. So just remember that every contribution does represent money set aside for those future healthcare expenses while providing that immediate tax advantage today. And here's a longer list of qualified medical expenses. And one of the questions that I hear most often, besides how much should I contribute to my HSA, is what can I actually use my HSA for? And the answer is probably more than you think. I know when I transferred over to Omnify and I started looking into the HSAs deeper, I was like, wow, there's so much you can use this account on. But HSAs really cover a broad range of those medical, dental, and vision expenses, as well as pharmacy related expenses and over the counter items. Everything from doctor's visits to prescriptions to orthodontia, LASIK, over the counter items, sunscreen is even eligible. The key is that understanding what is eligible and keeping appropriate records is really going to be important here. And resources like the IRS publication 502 and the hsastore.com make it much easier to identify qualified purchases and ensure that you're using your account correctly. I also like to touch on with the HSA, going back to retirement and long term goals. COBRA premiums are HSA eligible, as well as long term care insurance premiums and Medicare premiums, excluding Medigap. So, this is another opportunity where your HSA can really help you in retirement. And if you are wanting to dive deeper on what is qualified, a much easier option to look at is the hsastore.com. I personally really like this website and I use it myself. It is super user friendly and it has a long list of eligible items, which is really beneficial. And you can even shop directly from the site, knowing everything there is HSA approved, and you can even use your Omnify Visa card on that website. Now, if you have an FSA instead, there's also the fsastore.com. It's a sister store to the HSA store, and it's going to work the exact same way. I really love using these accounts. Or these mobile sites, but they're really convenient, easy to navigate, and they're just really great for making sure that you're spending your funds on qualified items. I know some things that are really popular right now on there is the Aura Ring as well as sunscreen. Those are just two that I see people use their HSAs on and FSAs on pretty frequently. And when it comes to planning ahead with your HSA, investing in your HSA is one of the smarter moves that you can make. This slide is not to scare you at all, but it's just going to let you know what's going to be coming up on the horizon. So, according to a study from Health Youth Services, a healthy couple retiring at 65 could spend anywhere from $156,000 to over $1 million on healthcare alone. And many people don't realize that Medicare doesn't cover everything, especially long term care, which your HSA can cover. So, it's really going to close those gaps. But that is why it's so important to start saving now. Don't wait on that. Take action today so that you can have that peace of mind for tomorrow. And I've talked a little bit about the investment HSA, but I'm going to go into that in greater detail. So at Omnify, we offer an investment option within your HSA, which is really designed to help you grow your healthcare savings over time and make those HSA dollars work for you, especially with that triple tax benefit. So once your balance reaches $500, any amount above that can be invested in a selection of 41 mutual funds across 8 fund families. And that's going to offer a wide range of options for different investment styles. So no matter what you're looking at, there's going to be something that fits your needs. And while investing is not for everyone, obviously, it is a really great option if you are looking to maximize your HSA's long term potential. I know a lot of people use a target date fund for more of a hands off approach that we offer, but the platform also supports more active investing to build your own portfolio if you'd like to. And we always recommend before getting started to speak with your financial advisor just to ensure that your choices align with your goals. Investing through your HSA is just going to let you take advantage of those triple tax benefits as well. And the investment list in your HSA is not just some list we whipped up. It's actually a fund menu that is monitored directly by Union Investment Management Group, or UIMG, which is a part of Union Bank and Trust. All funds are institutional share classes, meaning that there are no commissions coming out of your HSA, which is super nice. And there's no transaction fees for moving money between your deposit and investment accounts or reallocating your investments every time. So you don't have to worry about any transaction fees. We always just like to highlight that there is a monthly fee of 0.03% to manage your funds, and that's going to be based off of your month end investment balance with a minimum of $2 per month and a maximum of $10 a month. I know that $10 per month can sound a little bit daunting, but to hit that $10 cap, your balance would need to exceed $33,000. So, really, this is going to make it a highly competitive fee structure compared to similar platforms. And as you plan for retirement, it's really crucial to factor in rising healthcare costs, especially Medicare and long term care. And many are really surprised to learn how much they're actually going to need to cover out of pocket expenses. So, Medicare Part B, this is going to be your doctor's visits and outpatient care. Right now, that averages about $2,040 per person per year. And then if you add on Medicare Part D, this is going to be prescription drug coverage. That's going to average out about $445 per person per year. And then if you are looking at additional supplemental coverage like Medigap or Medicare Advantage, that can be up to $2,400 annually. And just to note, on average, Medicare only covers about 62% of total healthcare expenses in retirement, and that's going to leave retirees responsible for the remaining 38%. So, just understanding these costs now can really help you set more accurate savings goals and avoid any financial surprises later on. And now I'm going to talk a little bit about long term care. And this is really a critical part of retirement planning. And it's often more common and costly than people expect. So, around 70% of Americans age 65 and older will need some form of long term care. And that can look different for everybody, whether that's in home assistance, assisted living, a nursing facility, or something else. So, these services can be expensive. Right now, a home health aide averages about $46,000 per year, and nursing home care averages around $82,000 per year. And in the final 5 years of life, families may spend over $100,000 on healthcare related expenses. And while costs vary by location and level of care, these figures just highlight the importance of planning ahead, factoring long term care into your financial strategy through your savings, insurance, and other resources that can really help protect both your finances and your loved ones. So, before we wrap up, I just want to talk about a few quick tips for being a smart healthcare consumer today. I know I've talked a lot about long term care, but let's go back to what you can do today. One, like I mentioned, shop around for care. Call providers or use online tools to compare prices for services like MRIs or lab work. Save on those prescriptions by asking for generics, using apps like GoodRx, checking for free samples if possible, or even using mail order options that's become more popular for any 90-day supplies. Also, stick with in network providers. This is something that I always like to highlight because what that's going to do is keep your costs down and you're going to reach your deductible faster. Also, don't overlook telemedicine. It's really convenient, super affordable, and it's great for minor issues like refills or common illnesses. And what I really like about telehealth is that you can actually do it from the comfort of your home in your pajamas, which is very nice, especially when you're sick. You don't want to go out to like an urgent care or something like that. And telemedicine can be significantly cheaper, so you can save your HSA dollars and keep them invested longer. Small steps like these can really lead to big savings over time. So I always like to just highlight those. But as you move forward today, really take time to apply any of these strategies that I talked about today. Be sure to review your current healthcare spending, estimate your future needs, and explore pre tax savings options like HSAs if you're not already, or if you are, think about maximizing those options. These tools can really make a big difference in managing both short term and long term costs. And finally, use the resources around you, especially us here at Omnify, from employer benefits to trusted websites to your financial professional if you are looking to invest. The more informed that you are, the more confident that you're going to be in making decisions related to your healthcare. And with that being said, here's our contact information if you need to reach out to us. We're available Monday through Friday from 8 a.m. to 5 p.m. Central Time. You can also email us at support@onfibenefits.com, or you can go to our website, onfibenefits.com, to log into your account. But on that website, you'll also find a variety of really helpful resources. That's going to include videos, forms, calculators, just a ton of stuff on there. So with that being said, I'm going to go ahead and check the chat feature here. I'm not showing any questions in the chat or in the Q&A box, but I'm going to stick around here for a little bit if there's anything you'd like me to go over again, or if you have a question related to anything I talked about today, please feel free to put that in the chat and I'll be sure to answer that in detail. Otherwise, I will give you a few minutes back in your day. Thank you so much, everyone, for attending, and I hope you have a great rest of your Wednesday. Thank you, Amy. Have a great day. Okay, I'm not showing any questions, so I'm going to go ahead and end this webinar. But thank you, everyone, for attending and have a great Wednesday.